In today's session at Medical Sciences by Naftali Muhumza, we want to discuss about drug distribution in the body. In the previous video, we have looked at drug absorption, whereby it is movement of the drug from the site of administration to the blood saturation, what we call systemic saturation. And after it has reached systemic saturation, now we want to see how is this drug in the systemic saturation. How is it moved to the target site to exert its pharmacological response? How is it transported and how does it reach there, and the factors that affect its distribution. And as we begin, we remind you to subscribe so that you can easily be notified whenever we release the video, like and share. So drug distribution is the movement of the drug from systemic saturation. From systemic movement, we are going to see the movement of the drug from systemic saturation to the body tissues or cells where they can exert their pharmacological or physiological response. And this movement of the drug from systemic saturation, if this is the drug which is already dissolved and in systemic saturation, it is transported in plasma, bound to plasma proteins like albumin. It is always bound to plasma proteins like albumin. So drug within the systemic saturation is always bound to albumin. That if I have the bound drug, it should be at equilibrium, it continues to flow until it reaches equilibrium with the free drug. So whenever the free and the bound drug, they are not at equilibrium, the drug continues to be distributed within the tissue fluid. And after being transported bound, this drug is always first transported to highly perfused tissues. That's why we are seeing one of the factors it depends on is blood flow. Tissues which are highly perfused, like tissues like the kidney, liver, and the brain, which are highly perfused with the blood, we see them the drug being distributed there highly, compared to less perfused. So these ones are highly perfused. Whereas less perfused tissues like skeletal muscles and adipose, they have little drug concentration. So when a drug is being distributed first to highly perfused tissues, after being distributed, it is redistributed. It is redistributed to these less perfused tissues like skeletal muscle and adipose. So among the factors that affect volume of distribution is blood flow or perfusion. So we are going to see that this free drug, after being formed, it can easily be distributed via the slit junction. And this one is going to lead us into the second factor, which is tissue permeability. That tissues like kidney, liver, which possess slit junction, we see the drug being highly distributed there. It is highly distributed due to presence of gap junctions, which differ from tissues which have a barrier like blood-brain barrier. Tissues with barriers like the CNS. This one is found on the central nervous system with blood-brain barrier. We see placental barrier. And we see even a testicular barrier. So these barriers, they do not allow high distribution of the drug within these tissues. In the testis, in the placenta, where to reach the fetus, and in the central nervous system. So these tissues, they have less volume of distribution. They are less distributed. The drug within these tissues, they are less, or they are less distributed compared to this one with slit junctions. And another thing we can now talk about is this distribution of the drug to the interstitium, that is the extracellular fluid, or to the intracellular fluid. This drug, free drug, can also be distributed into the extracellular fluid or matrix. So it can also depend on the chemical nature of the drug, whereby some drugs are hydrophobic, but the drugs which are hydrophobic, that is lipid soluble, they are highly distributed. Whereas drugs which are hydrophilic, those ones are water soluble, they are less distributed. That is the chemical nature of the drug. Another factor that affects this distribution of the drug into the interstitial space and the intracellular fluid, or at the site of action, is the plasma protein binding, which we have seen that these drugs are transported in the blood vessels bound to plasma proteins, especially albumin. So when the drug is bound to albumin, albumin is big or large in size. It cannot cross, or it is not permeable to the tissues. So drug which is bound, it is less distributed compared to the free drug, So if there is more, the ratio of plasma protein when it is high, less drugs are distributed in the tissues. And this it plays a very significant role to maintain drug concentration within the plasma. Because if all the drug was free, it would be absorbed in the tissues at once. But because it is bound to albumin, it keeps releasing the free drug slowly. But if I have bound drug, and it is also, we have the free, when this free is done, more of the bound is also converted into free. So that to maintain the concentration of the plasma, of the drug in the plasma. That is the or the clinical significance of plasma protein binding. And after looking at these four factors that affect distribution of the drug, lastly we can look at what we call apparent volume of distribution, which is defined as the volume that contains all the drugs, the volume in the body which contain all the drug, provided, or we assume, if the drug concentration, if the drug is the same in all tissues, if the drug concentration in plasma, the drug concentration in plasma is the same. So the volume in the body which can accommodate all the drug, which can accommodate all the drug, provided the drug concentration, or assuming the drug concentration in plasma is the same throughout the body, is the same throughout the body, is what we call apparent volume of distribution, denoted by Vd. Volume in the body that accommodates all the drug, provided the drug concentration in the plasma is the same throughout the body. And this is calculated whereby volume of distribution in liters is equal to the dosage, drug dose, or the dose of the drug given intravenously, that is IV, in mils. This one is in milligrams. You divide by the drug concentration in the plasma. That one measured in milligrams per liter. So this is the formula that we use to calculate the volume of apparent volume of distribution of a drug. That in case, we can give an example, in case the dosage of the drug is 10 milligrams and the plasma concentration of the drug is 1 milligram per liter, the volume of distribution will be 10 milligrams divided by 1 milligram per liter, which we shall give us 10 liters as the volume of distribution. And we shall conclude by saying that drugs which have, we shall note that drugs with high volume of distribution, they are highly distributed in tissues. It means that this drug is highly distributed in tissues. And those ones with low volume of distribution means they are less distributed in tissue, in body tissues. So meaning that drugs with high volume of distribution, they are majorly lipid-soluble drugs which are distributed throughout the body tissue, and we cannot even eliminate them from the body in case of high dosage by dialysis, compared to the ones with low volume of distribution, which can be eliminated by dialysis in case of toxicity. So this is the implication of volume of distribution, that whenever we know volume of distribution, we can easily know the dosage we can give to the patient vis-a-vis the kilograms. So this is the implication of apparent volume of distribution. Thank you so much we have been together from the beginning, where we have looked at distribution of the drug from the systemic saturation to the interstitial space and intracellular fluid, whereby they are transported bound to plasma proteins like albumin, and we have seen different factors that determine volume of distribution within the body, which is blood flow, that is perfusion, tissue permeability, chemical nature, and plasma binding. Thank you so much for listening.